Greetings, friends and followers. This is Nurses Talking. I am Dale Barzi. As always, if you like what you see and hear, give us a like, subscribe. We'd love to read a comment. Today, my guest is Mr. Kenneth Lubigan in the Philippines. Kenneth is a registered nurse, a clinical instructor, a professor, lecturer, a home care nurse, a nurse aesthetician, and a PhD student. Welcome, Mr. Lubigan.
Hi, good day, Miss Dale, and thank you for the invitation to be part of your very nice YouTube channel.
Well, thank you so very much for joining me. I appreciate it. I know we're 13 hours apart, so you're staying up to speak to me at
Yeah,
night.
actually, that's why I made this background that you can see. It's night here in the Philippines.
Yes, yes. Thank you so much. So let's just jump right into this and tell me, why are you a nurse?
Well, actually, it's a good. I believe me becoming a nurse is a blessings because it started way back when I was still high school when I was working. I'm a church worker, way back when during my high school time. And a very good friend of a priest came in the Philippines who actually worked there in US. She based in Houston. Her name is Tita. I call her Tita Beng. It's now my godmother, Tita Beng, when I get married. And uh, she's the one who let me be. She gave me the opportunity to be a nurse. She asked me if I will be willing for her. Actually, she was my beneficiary.
Wow.
She sent me to school. Sent me to school. That's why I'm a nurse right now.
Okay, okay. So that's awesome. So in the Philippines, I'm not familiar so much with how it works in the Philippines. What is required for you to become a nurse?
Well, in the Philippines, you have to face, of course, because right now it started just a few years ago. We already have the senior high school, but during my time, you just need to finish grade school, senior, then the junior high school. You go to college for 4 years, and then you take the board exam, and then if you pass, then you can now work as a professional nurse in the Philippines.
Okay, okay, okay. So what were the challenges for you, particularly doing this?
Well, as a nurse, or would I as a nurse,
Actually
well, there's a
getting there,
lot.
yeah. Mm-hmm.
Yes, because here in the Philippines, the problem is if you know the news that a lot of Filipino nurses are working abroad, not here in the Philippines, it's because of the salary. It's very low. Like, for instance, when I started working as a nurse, our salary was just 100 to 115 US dollars. That's how low the salary here in the Philippines. And when you work in the public hospital, the problem is even the supplies, the medicines, there is not enough of that for the many Filipino patients that you are catering. So that's very hard for us. Those are the struggles that we face, all public health nurses.
Yeah, these are your biggest challenges. Wow. So which means to me then that you have to become very creative and very innovative in trying to get things done if you're so short of supplies and staff and that kind of thing.
Yeah, we need to be resourceful. Like, for example, when the what do you call this? The the thing that we used to get the blood pressure,
Okay,
when
the
it got cut,
sphygmomanometer.
we used then the syringe to put it together so that it can still
Yeah,
work. So
yeah,
we need to
yeah,
be resourceful, especially when you're working in the public hospital here
yeah.
in the Philippines. Especially that I am based in the province. Actually, right now I'm located here in Batangas City, Batangas province in Lipa City. So it's a very not it's a little bit far from the city of Manila, which is
Okay.
the capital of the Philippines.
Yeah, 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 yeah. Yeah. Wow. That's awesome because I in the US we tend to have a little more stuff at our fingertips, and it's very interesting to see how someone with fewer resources has to create stuff. It opens up your creative juices and your creative abilities to get things done. You get the same things done
It's
a
actually
little
because
more creatively.
nursery in the Philippines are very creative. Sometimes they become the janitor. Sometimes they become the phlebotomist. They sometimes act some like a good doctor thing because
Mhm.
the resources in the Philippines is very. I mean, we need a lot of things. That's why some Filipino workers are really into abroad, like they're in US. Many Filipino are working abroad because
Yeah.
except from the low salary, they are having hard time because of the supplies, and not all the time you can be resourceful because there's no resources at all that you can make it more.
Yeah.
Even you
Yeah.
are creative, but there's none. How can you do that? For example,
Yeah.
medicines. Sometimes we bring our own medication. For example, there's one time we have a patient who is having seizure. We are working in a public hospital. There is no medicine like diazepam to get the patient well. So we have to bring our own
Oh,
up to
wow.
that point. So it's very hard.
Wow. Yeah. Wow. That's dedication. That's dedication. Really, it is. So, what areas have you worked in? What specialties of nursing have you worked in?
Well, actually, when it comes to the areas, actually, I have worked with a lot of areas, like in a cancer area, cancer institute. We
Mhm.
also work in medical, surgical, nursing, pediatric, everything. I think all of the possible. Maybe even in maternity and child,
Yeah.
you
Yeah.
handle patient who's
Yeah.
giving birth or give birth already.
Yeah.
But my specialty, I would say, is emergency room and critical
Okay.
care.
Okay. Okay. And what draws you to that?
Well, it's nice to have because when I was working in the hospital before, because I resigned and I just do now private home care and the aesthetician practice,
Mhm.
because I want adrenaline rush. Parang
Ah,
it
I
makes me
get that.
think. Yeah, yeah, right. When you are having that kind of thing, parang your mind thinks faster,
Yeah.
and I can apply it outside the hospital. For example,
Mhm.
you met an accident or in the family something happened, then
Yeah.
you can really make them well, and you can really assess if you need to go to hospital or if you can already do things to make them well. So it's very
Yeah.
good because the assessment will always be there. The
Yeah.
critical thinking will be very, it's really fast. So you really
Yeah.
have to do that.
Mhm. Yeah. Your mind works at warp speed. I get it. I get it.
Mhm.
So you do home care now.
Yes.
Okay. And why?
Well, because during the when pandemic, came in, there's a lot of people here in the Philippines that do not have enough money to go to the hospital because hospitalization is very expensive, and the other have money, they are afraid because if you saw or if you see the effect of it, many patients died in hospital
Yeah.
set up. Probably
Yeah.
because they go to hospital when they are already not feeling well or very weak, but
Mhm.
because of I grew up in church, and sometimes you get when people call you Kenneth, somebody's needing help here, blah blah blah. Actually, I do came there without any. I know you can just
A
we just say
perception.
thank you. Yeah, you just say thank you. You bring your own supplies, and I see how people needs to be taken care of, even not in the hospital setup. And also, I think education is a very important thing. Now you
Indeed.
educate not only the patient but the whole family, the whole
Yes,
member of the
indeed.
family,
Yes,
and
indeed.
it's nice to see them well. And maybe I said to myself, there's a lot of people working in the hospital. Maybe I need also to focus in working for these people who don't have enough money to go to hospital to be taken care of.
Uh-huh. Uh-huh. Awesome. I mean, that is so huge. That really is awesome. That's all I can say about that. And so you're also a nurse esthetician.
Yes, I do. Though I'm not yet a licensed esthetician in the Philippines because
Mm-hmm.
there's another specialty like in your country. I have a friend in the US also doing
Mm-hmm.
that, and they are fully licensed.
Yes.
But I just put, for example, it began also during this pandemic when I just give them glutathione supplements and also the high dose of vitamin C that gives them more because they want to be like the Filipino people want to be whiter because we have a brown color skin.
Mm-hmm.
So because Filipino feels like if they feel white, if they are whiter, they are more beautiful. So that is why
Okay.
they love
Okay.
glutathione.
Okay. So what would be your vision for nurses and for nursing in the Philippines? What would you
Well,
like to see?
actually, I'm actually a member of the Philippine Nursing Association here in the Philippines, in a local here in Batangas Region 4A. Maybe the vision is also to change the setup and the treatment, because if you can actually see or experience comparing nurses in the Philippines in the US, because in the US, if you're a nurses and you met a doctor, it's like you have the same kind of a what they call this, of in the professional level, you're the same.
Yeah.
But in the Philippines, we have this kind of what do you call this term, that we are just someone that,
Hierarchy.
yeah, the hierarchy. And also when it comes to the what they call this salary, no, it's
Yeah.
very important, because we are, for example, like here, like now, because the pandemic kicks off, we are dedicating our life, we are what they call this, we are giving our life, but the salary that we receive is not
It's
really
not.
comparative to that, and that's very
Yeah.
bad. Again, that's the reason why a lot of Filipino want to work abroad, because here in
Uh-huh.
our base country, they are not giving enough attention, enough privileges, enough of everything for us nurses. So I want that to be changed. I want that to be changed,
Yeah.
and probably it will really take time. But I believe with the help of so many organizations in the Philippines, if they united
Yeah.
and keep united, they can make a really a change with
Yeah.
this kind of situations.
So as you talk about, salary and the hierarchy and stuff like that, how does the public view nurses? Are they respectful to nurses? Where I come from, if you're a nurse, I'm not originally from the United States. I'm from the Caribbean, and typically, if you're a nurse, people tend to accord you a certain respect. The community tends to do that. Is it the same in the Philippines?
Well, actually, in the Philippines, yes, they all actually respect us. If they, but the thing is, you know, they respect us because actually right now they need us. Okay, but before, when the pandemic kicks off again,
Yeah.
sometimes they avoid nurses because they think that if you are near to the nurses, you're going to be infected. And sometimes
Oh.
you get bullied because of that, and
Oh,
because
wow.
like there are some not so good thing that they said that if you are a nurse, you are being paid well and you have to work really nice for us. But actually, it's not that. We are working not because of the payment, but because that is our job. We have an oath to take care of life, regardless of how you are
Yeah.
being paid.
Yeah. 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 Wow. 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 Awesome. So if you, I'm sorry, what words of inspiration do you think you would give? What advice would you give to someone who wants to be a nurse? What would you say?
Well, right now I'm actually a clinical instructor in the Philippines into school.
Yeah.
So I always tell my student to, if you really love nurses, you really need to love being a nurse, because it really needs dedication. Now, you don't have to work based on the salary, based on what people's respect. You have to work because that is your job, that is your profession, that you need to love it. You have to, regardless of the outcome on how people will react on you, that's your job. So you have to work with your heart in
Mm-hmm.
it.
Mm-hmm. 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 Exactly. Exactly. There is something that I always want to know from nurses, because we tend to work so much that we run the risk, or we have the thing to take care of ourselves last, and very often we don't. So I always asking nurses, what do you do for self-care? What do you do for self-care? What does it mean to you, first of all, self-care, and what do you do?
Well, as self-care, just like what I did, because working in the hospital is really this. I'm not saying it's not right to work in the hospital, but there are already people dedicated
Yeah.
working there in the hospital.
Mhm.
When I saw that it is not, I'm not really needed,
Yeah.
or
Or
I feel
fulfilled.
exhausted
Mhm.
working in that, or in whatever areas, you have to also maybe, because nurses has a lot of specialties. Like
Yeah.
you can work in the hospital setup, you can be a clinical instructor, you can be a home care nurse, just like what I'm doing. Maybe you also need to give yourself a break. A break, not by not doing the work, but also choose a specialty where you enjoy working as a nurse. Where you can also, when you are not really abusing, because if you don't love yourself, if you abuse yourself, then later or later or after a few years, you're gonna be sick. And
you can't do it anymore.
yes, right. Especially that nurses, the primary way to do our work is through service. We act. We the one who attend. It's not like in the computer that after a person make a program, it will work just like Facebook or just like Zoom. In our job, we have to really be physically present to do
Present.
our job. And if you do not take care of yourself, then later or sooner you're going to be sick and you cannot do anymore your thing.
That is absolutely true. That is absolutely true.
Yes, right.
Some of us have learned that the hard way. So you're a PhD student now.
Yes, I am. Actually. I will just plan to enroll for another semester because we just finished we have a trimester here. Actually, we had the classmate who came from China and Indonesia, international school. So sometimes it's also give us hard time because we are Filipino. Our native tongue is Tagalog. That's why we are also sometimes having hard time speaking English. But not all the Filipino are like me because there are a lot of Filipino nurses very good in English. It so happened that maybe it's my negligence not to really practice English well during my younger age. Why?
Your English is quite fluent.
Oh, I hope I can pass the IELTS so that I can go to like in the UK or in the US.
Your English is quite fluent. Thank you so much for that. But really, as a PhD student, so now what is your goal? Where do you see yourself having accomplished this? What do you want to do with it?
Well, the reason why I'm studying the doctoral philosophy in nursing actually is because I want to upgrade. Because in nursing, you don't need to stop in just working in the hospital setup. You have to really, education is continuous process, right? So every single, like what you have interviewed before, because I've said a while ago, I watched some of your videos. There's one thing they said, every single day they still, even though they are so, they are already 45 or 35, they still learn new things. And probably that's the reason why I'm studying PhD. And probably too, because in PhD you sometimes make a recommendation, you study things in a deeper way so that maybe you can make a change on, for example, what do you call this, you can suggest
Policy.
innovations.
Yeah.
Yes, innovation that can change the view and everything about nursing that will help, if not you or me, but the next generation of nurses, so that they will not suffer the same thing that we suffered when we are the one at their position.
Yeah, absolutely, absolutely. And that is one thing that I am really excited and enthusiastic about, is that as we go on, more and more nurses are pursuing higher and higher education, and the profession as a whole is being lifted up just by that. So I thank you for that.
Yeah, actually, because that's the very thing that we wanted to do, because we don't want to people to always think that nurses are just the one that who assist the doctor in doing these
I
procedures or
know.
that. We also have our own individual specialty, and we can go
Exactly.
further than just being in the hospital. They
Mhm.
just don't know that there are people in the government higher position who is actually a nurse
Yeah,
that they do
yeah,
not know.
yeah, yeah, yeah. And you bring those skills and qualities to the to very different areas. Yeah,
Yeah, actually.
yeah. So I have been collecting words, Kenneth. I've always wanted to know from nurses now, if you had to describe one essential quality of a nurse in just one word, what would that word be?
Commitment.
All right, this is your word, commitment. Why commitment?
Well, commitment because w- I mean, depending on the place where you are right now or the kind of government that you have, or their sympathy on you and the people. If you're a nurse, you really need to work as a nurse. Just like what they call a wife and husband relationship. Sometimes you have not so good situation. Sometimes you fight, but you are committed to stay and
Mhm.
make it work because you married that specific person. And in
Mhm.
nurses, if you marry that profession, you really need to work as a nurse, regardless of how people will respond, as long as you are doing your job. Sometimes
Mhm.
you have to put away emotions because we're in our country, Filipino are very, our emotion is very, I
Up there?
mean, we love appreciation. But
Yeah.
what I see is that regardless, you have to work, regardless of the payment, the salary, because
Mhm.
I mean, it's your identity. It's
It's you.
if you work this way, that's you. No, it's not. I mean, you will be called. You will be remember the way you do things for them. That's why as they said. I hope you know that they call the Filipino nurses as one. We have the tender loving care. That's why they love us to take care of them, especially in abroad.
Okay, so you just said something that sparked a question in my head. You said, being a nurse is it becomes your identity. Um, if you were not a nurse, what would you be?
Actually, I do not know because one of my dreams is to become a doctor.
Okay.
Yes, I want to be a thoraco-vascular surgeon, the one who opened the heart,
Yeah,
right?
yeah,
To
yeah, yeah.
change to make the people live longer because their heart is full of blockage.
Yeah.
I think maybe a doctor.
Okay. So you would always have been in healthcare, one way or another.
Yes, and because I actually proved that actually becoming in this field is accidentally, just like I've said before. It's my
Hmm.
Tita Bang who
Yeah.
actually put me into this line. But I really appreciate it, and I am thankful because with if I'm not a nurse, maybe many of my relative has already died because especially of pandemic. Or we have case of dengue here in the Philippines, like
Yeah, yeah.
APTB. So if you don't know, if you cannot assist them, they probably died already. So it
Oh,
really pays off.
yeah, it does. It does. It pays off in many ways. What
Yeah.
would you say is your greatest achievement so far? So far.
Uh, Greatest achievement, I learn things and value life more, especially the family and actually every single life. That sometimes money is not the only way you can be
Mhm.
healthy.
Yeah,
Sometimes it's
yeah.
education, sometimes
Hmm.
it's knowledge. So
Hmm.
that's the thing that I really value right now.
Hmm. Hmm. Awesome. Awesome. Um, when I think of that and you think of what your achievements have been, especially, when you get to a certain age, I have been a nurse for greater than 45 years now.
Wow, that's too
Um,
long. That was so long.
yeah,
Very
yeah.
long, yeah.
And I've been a nurse, I've been a mom, my children are grown, I've retired within the last 3 years, 3 to 5 years. And one of the things that happens once you retire and you're an empty nest, your children have grown and gone, you start assessing what really is your worth. What have you done? What have you achieved? Um, and as you're doing it, as you're going through it, as you're raising children, as you're doing your job and stuff like that, you don't necessarily see it as an achievement. When you look back on it, it's only then you think of it as, oh, I did do this and I did do that and I did, and I really would like nurses, or people in general, but since I'm talking to nurses, is to appreciate the little steps along the way as they achieve stuff, to see the steps that they're making, which is why I asked the question, what's your greatest achievement so far? Yeah.
Yeah, because learning is a step-by-step process.
It's a step.
Just like everybody, I mean, I think everyone else. Sometimes there are failures, there are hard times. That's what, like you have asked me a while ago. Some are little, some are very big. Sometimes really like put you down. But maybe one thing that I just managed to do is to keep going. Just like said, a life will go on, no matter what. Even if
Yeah.
you're sad, the world will still keep on rolling. They will not
Yeah.
wait for you to be happy to keep it rolling. So that's life.
That's
Whenever, even if I finish a lot of PhD, I will die. So let's enjoy life. Let's do our job with our heart on it, with our mind, because we're going to take care. We are taking care of life. So that's a very important. That's the essence of being here in this world. So dedication and commitment is very important.
that is such a powerful thing you said, that it's the essence of being here in this world. Thank you for that.
Yeah. Thank you. Welcome.
On that note, is there anything else you'd like to share with us?
Well, maybe especially in what is happening right now, I hope that our leaders, the world leaders, the one who can really stand for, not actually for nurses alone, because we are just the frontliners of this world when
Mhm.
it comes to health. I hope they can really make a change, not only for the specific country, but for the world,
In general.
the whole world. Like, sorry, because I'm not good in pronouncing the word R. I have difficulty because I'm tongue tied. No, sorry
Yes.
for the viewers. But then that's maybe what I'm trying to maybe ask to, like, in the United Nations, in the what do you call this, the United Nations and the
Yeah, all
WHO.
the
I hope you decide not only in the benefits whether the country can afford, but for the effect that will affect in every country, because we are living in the same world. And
indeed.
like, for example, this pandemic, it started in China, as they said, it started in China, but it affect the whole world.
Exactly.
So whatever you do and you decide, I hope you really think of life, because life for me is the absolute thing that we should think of before we decide on every given agenda or thing that they have.
Awesome. Awesome. Kenneth, thank you so very much for staying up to talk to me. I really appreciate your time. I appreciate the conversation, your enthusiasm. Thank you so very much for today.
Yeah, welcome. And I'm also grateful that you actually have an intention in interviewing a person like me, because I'm just like an ordinary nurse here in the Philippines. But I think you don't have to be really special to give your voice and to be heard, because we who are working in the lower part of this healthcare system, we who are working in not so rich country like here in the Philippines, also has or have maybe most of the battle cry that the leaders of this whole world needs to hear,
Need to
for
hear.
them to be able uh, uh, to formulate, or to whether decide to go or not to go, whatever they are planning, that
Yeah.
they think, because our leaders just listen to the people around them, not to the people who will be
Well, actually,
affected
in
by
this.
that decision,
Yes, yes,
because we
yes,
are far from them. They
yeah.
only receive sometimes reports or probably statistics, but sometimes they also need to listen to just like on how we care with our patients. We cannot assess our patient but by just asking the relative. We go to the
We
patient
go to the.
directly.
Yeah, yeah,
We see
yeah,
if they're saying the truth. We see their verbal, non-verbal cues for us to really give the appropriate treatment or intervention.
yeah, yeah, yeah. And this
Yeah.
this this is why I'm very happy for nurses like you who are taking up the mantle and joining uh, uh oh dear,
Organization.
associations. I couldn't make the word for a minute. Joining associations and furthering your education, putting yourself in a position to affect policy and outcomes and things like that. So thank you very much.
Yeah, welcome also, and thank you again for this a very for me it's a privilege to be part of your YouTube channel and to be interviewed by a person like you, because I've said I'm just a simple nurse here working in the Philippines for the good of humanity in a simple way, just like Mother Teresa said, if even a single drop of water is a part of the sea, so I hope I can be that one drop of water.
Thank you so much. And I'm going to ask you to stop referring to yourself as simple and ordinary. There's no such thing as ordinary or simple. You are doing your part. And without you, that every person is an integral part of this whole thing. So thank you.
Thank you, Miss Dale. Thank you, Miss Dale.
All right.